Welcome back to Cycle Wisdom, where we empower women to restore natural menstrual cycles to improve health and promote fertility. I'm your host, Dr. Monica Minjeur, and I'm so glad you're listening today. On today's episode, we're going to be talking all about charting your cycles with a fertility awareness method while you are postpartum or breastfeeding. I thought this would be a great topic to cover because there's so much misinformation out there, and so many women get sent home right after delivery with some form of hormonal contraception without really getting their questions answered. So we're going to be talking today about the physiology of breastfeeding, what the different hormones are that play a role with the return of your menstrual cycles, as well as help you understand how to use a fertility awareness-based method in order to chart your cycles while you are breastfeeding. This can be really important for people who may be trying to avoid a pregnancy or just space things out with your family planning, as well as give you an indication of when your menstrual cycles might return. So, as always, we're going to start off with a patient story about Jessica. She came in for a regular checkup with me when she was about 4 months pregnant, and she was very excited to be pregnant. But she was also quite concerned because she wanted to be able to space out their family and didn't want to get pregnant again right away after delivering this baby. Jessica's OB doctor had already talked with her about starting her on the birth control pill right after she left the hospital, but that really wasn't something that she wanted to do. Jessica was hoping to find more natural ways in order to be able to manage her cycles and understand when her fertility returned. So Jessica and I discussed this further, and I let her know that there was a way that she could chart her fertility signs to know when she was fertile, even in the immediate postpartum timeframe. We got her signed up with one of our charting instructors, and they actually taught her the fertility awareness charting method while she was still pregnant. This way, she would be able to know what was going on with her cycles and start her charting a few weeks after she gave birth. Jessica ended up going on to successfully breastfeed her baby full-time, and she was able to use what she understood from her charting observations in order to see when she was potentially fertile. She used her knowledge of charting and return of fertility in order to avoid a pregnancy successfully. She was then able to apply the same charting instruction in the future to know when she was fertile and achieve a pregnancy again when they were ready to do so. So let's talk a little bit about some of the physiology of breastfeeding and what makes your cycles and fertility different when you are breastfeeding. So as that baby is at the breast and suckling, it sends a signal to the mother's pituitary gland, which is in the brain. The pituitary gland then secretes prolactin and oxytocin, as well as other hormones which will block ovulation, like gonadotropin-releasing hormone, follicle-stimulating hormone, and luteinizing hormone. We know that these levels can be very important as we are evaluating lab work from a hormonal standpoint, and when a woman is breastfeeding a baby, it is stimulating her body to increase these hormones. The other hormone that I just mentioned, oxytocin, is responsible for contracting the cells around the milk ducts and helping milk to be expressed. Oxytocin levels will also increase if a mom hears her baby cry, as well as if she's touching, seeing, or smelling her baby. Oxytocin also induces a sense of calm and reduces stress levels, as well as enhancing the feelings of bonding between mom and baby. This is oftentimes why I talk about the importance of direct skin-to-skin contact in order to help with bonding, because it helps to release oxytocin, which sends those feel-good chemicals to the brain. The most important hormone that plays a role with breastfeeding is going to be prolactin. Now, we did talk about this hormone quite a bit in my recent episode called All the Other Hormones. And so you can hear more specifics about it in that particular episode. Just keep in mind that baby suckling will stimulate milk production and increase levels of prolactin. However, that doesn't tend to occur until about 30 minutes after starting a nursing session. Because of this, the prolactin increase is actually most important to make milk for the next feeding. The other thing we see with prolactin levels during breastfeeding is that levels are higher at nighttime naturally, which helps a mother to feel relaxed and sleepy. There is also a direct correlation to prolactin levels as well as milk supply within the first few weeks. So when your prolactin levels are elevated more, we see the supply increase accordingly. When prolactin levels are elevated, this will also work to block ovulation, which is oftentimes why we'll see a delay of the return of menstrual cycles when a woman is exclusively or frequently breastfeeding. Think about it as your body's natural way to try and space out pregnancies so that you can nourish the baby that you currently have. I will make one distinction here that's really important when we talk about breastfeeding and charting your cycles in regards to the return of fertility after pregnancy. So when you're using any fertility awareness-based method, it's critical to understand the difference between if a woman is considered to be totally breastfeeding or partially breastfeeding. So totally breastfeeding in the medical sense means that you are either completely breastfeeding baby or pumping. So no other source of food, no water, no formula, no donor milk. Everything that baby is getting for nutrition is coming directly from mom. The other option, like I had mentioned, is if you are exclusively pumping, ideally at least as frequently as the baby is eating. So if the baby is taking a bottle every 2 to 3 hours, we want to make sure that you're pumping that frequently as well, including overnight. Now, if this is the case, then exclusively pumping would also meet the criteria of totally breastfeeding. Now, if we're defining instead partial breastfeeding, that's going to be in women who are pumping or nursing as much as they can, but maybe they don't have enough supply. This may mean that they need to add in a bottle of formula even once a day, or they may be getting donor milk. Also, as that child is getting a bit older, and if they are taking in any water or solid foods, those would be cases that are considered to be partially breastfeeding. Now, this doesn't mean anything as far as the right or wrong way to feed your baby, but it does make a difference when it comes to charting your cycles and the return of your fertility. So, let's go back and talk about the woman who is totally breastfeeding or pumping regularly. And what we know is that for the first 56 days, which is 8 weeks after giving birth, a woman is considered infertile if she is exclusively or totally breastfeeding or pumping. We can utilize many different charting methods that encompass different phases of your fertility journey. However, one of my favorites for this time frame is Creighton model, as they have specific protocols and education pieces in regards to charting your cycles during breastfeeding. There is actually another option as well called the Lactational Amenorrhea Method. And this means that if a woman is totally breastfeeding and letting her baby suckle at the breast, so using the breast as a pacifier, then a woman will likely not have a period during this time. Now, there are 3 very important distinctions with this particular method. The first is that it can only be used up until the time that baby is 6 months old. The second criteria is that a woman must not have a return of her periods during this time frame. So once she has a period, then she can't use this as a method for prevention of pregnancy. And the third criteria that must be met is that she must be totally breastfeeding with no more than 4 hours between feedings or pumping. Now, this method also recommends that the baby is not using an external pacifier other than mom. If these 3 criteria are followed, this method is actually up to 98% effective at preventing pregnancy during the initial 6 months after birth. Now, on the other hand, if a woman is partially breastfeeding, her fertility can return quite early. So even if the baby is only getting a supplement of 2 ounces of formula once a day, you cannot just assume that you are infertile. In fact, the earliest reported ovulation after childbirth in the medical literature was 27 days. Now, the reason this is important is that if you are trying to avoid pregnancy, even if you haven't had a menstrual cycle yet and you're only partially breastfeeding, you need to be watching for fertile signs which can indicate ovulation is occurring. So let's talk a little bit about when fertility returns and how we utilize a charting method in order to identify that time frame. Interestingly enough, up to 1/3 of all women will ovulate and have a fertile window before they have a return of their menses after giving birth. Now, this makes it incredibly important to be watching for that fertile time frame rather than just waiting for your period to come back before you assume you could get pregnant again. Now, this is relevant especially if you're trying to avoid pregnancy. Remember that if you ovulate, you can become pregnant even if you haven't had a period. So it's really important to be paying attention to your fertility signs. Typically, women who are breastfeeding will notice mostly dry observations if they are checking their cervical mucus or cervical fluid. However, some women may notice a continuous mucus discharge, and either of these patterns can be normal in the breastfeeding timeframe. Now, generally, we see that once a baby starts to wean or is going for more than 4 to 6 hours without nursing or pumping, then we'll often see this variable return of mucus occur, which can signal that ovulation is preparing to happen. Another time that we see it common to begin ovulation is if there has been a significant reduction of nursing or discontinuation altogether. In those cases, we notice that ovulation and fertility can return within a month. However, normal ovulatory function may take up to 3 menstrual cycles to get back to baseline. Even after ovulation occurs, when charting during breastfeeding, we oftentimes will see a variable pattern that just doesn't look completely normal yet. I usually recommend to just wait a couple of months to see how things settle out while we await the return of regular ovulation. Even with women who are completely breastfeeding, it can be an extreme range of variability as to when that menstrual cycle will return. On average, most women will have a return of their menstrual cycle somewhere between 9 to 18 months after giving birth, but certainly some may be sooner and some much later. Just as every pregnancy is different, so is every postpartum timeframe in regards to when fertility returns. And for this reason, it's vital to be evaluating your symptoms on a daily basis to understand exactly what's going on. I would also like to add in here a couple of tips as far as helping to increase your supply and maintain a steady supply of breast milk even after your periods return. Now, the most important step that is easier said than done at times is overall taking care of yourself as a mother. Make sure that you're getting plenty of rest when you can. Now, this may not always mean actual sleep, but sometimes it may mean getting some restful, quiet time. Also, incredibly important to make sure that your fluid intake and your food intake is adequate to keep up your energy levels and your supply. Another big thing that I counsel women on is just increasing the general frequency of nursing, which can be called nursing on demand. Now, this is going to mean offering the breast anytime the baby is crying or is hungry. You're not going to be looking at a clock and saying, oh, you know what, baby just ate 30 minutes ago or an hour ago. They can't be ready for more yet. If you are trying to increase or maintain your supply, feed baby, soothe baby as often as they need. You can also use the breast as a pacifier to help with suckling. And again, even if it doesn't seem as though baby is getting any milk out, as we talked about at the beginning of this episode, the act of suckling itself will increase prolactin response, which encourages more milk supply for the next feeding. Now, I know this can take a lot of work, and depending upon if you're returning back to the workplace or have other children, it can be really challenging. Most importantly, but perhaps one of the toughest things for some women, is to try to nurse under calm conditions. Now, this may mean going to a quieter room, turning down the lights, and getting comfortable to allow yourself to relax and let that milk letdown occur. If you notice a drop in your supply after your periods return, make sure that you're getting plenty of calcium and magnesium. Ideally, calcium either in supplementation or in food form of at least 500 to 1,000 milligrams per day, especially during your luteal phase, from the time of ovulation up to and through the first 3 days of your menstrual cycle. With this addition of calcium and making sure you're getting adequate levels, it can oftentimes avoid a drop in supply if you're still nursing when your periods have returned. Just as a final note as a resource, one of my very favorite books regarding breastfeeding is called The Womanly Art of Breastfeeding, which was written by La Leche League International. This book is amazing. It saved my breastfeeding relationship with my own kiddos on many occasions. It has wonderful resources as far as troubleshooting, what's normal versus not, and a multitude of examples to help meet you wherever you are on your breastfeeding journey. It's a great read for anyone from the mother-to-be to the experienced mother who may be having issues with a new baby. I hope this episode has been helpful for those of you who are currently pregnant or those looking forward to that time in order to understand how you can use a fertility awareness method for navigating all the stages of your reproductive journey. If you're ready to work with our elite team of healthcare professionals, go to our website, radiantclinic.com, to schedule a free discovery call with me and learn more about our package-based pricing for healthcare. We customize your treatment plan and include options to access a hormone coach, fertility awareness charting experts, a registered dietitian, a health coach, and of course, all the medical care you need from me as a board-certified physician. We are currently able to see people for in-person appointments in the Cedar Rapids, Iowa area, or can arrange for a telehealth visit if you live in the state of Iowa. Thank you so much for listening to this episode. Please share this podcast with someone in your life who would benefit from our services. Remember to subscribe to this podcast for more empowering content. I sincerely appreciate your support, and I look forward to sharing more with you on our next episode of Cycle Wisdom.